Abbreviations and shorthand have been part of healthcare forever. Pretty much everyone uses them, and most of the time context makes them easy to understand. But when information moves between systems, sometimes that context can be lost. Today we're going to talk about semantic interoperability and why it's so important when we exchange healthcare data. But before we jump in, if you're new here, I'm Trey, a health IT consultant and founder of the Dragon Network. Let's start with a quick recap on data exchange. In health IT, interoperability is often described in layers. At the most basic level is foundational interoperability. This is simply the ability to exchange data between two systems. For example, a lab result being sent from a lab information system to the EHR. The next step is structural interoperability. This makes sure the data arrives in a consistent format so it fits into the right fields, which means the lab results would show up in the right place in the chart. Finally, we have semantic interoperability. This is where the meaning is clear and consistent. For example, the value Na is recognized everywhere as sodium and not as something unrelated. As health IT professionals, we often focus on the foundational and structural layers, making sure data gets from one place to the other and that it's going to land in the right spot. But we also need to understand the technical architecture and the clinical contents of the data to make sure that the meaning is preserved. Exchanging free text abbreviations simply isn't enough. It can lead to confusion, misinterpretation, and impacts to patient care. Let's take a look at a quick scenario. A patient goes to urgent care on the weekend with abdominal pain. After a quick workup, the provider documents the encounter in their EHR as a free text note. The patient is discharged on over-the-counter acetaminophen, and a visit summary automatically flows over to the primary care provider. When the family doctor opens it the following week, the summary shows an assessment of abdominal pain, possible UC, and a plan of follow-up with primary care provider for specialist referral. But what does UC mean here? Is it ulcerative colitis, which would point towards gastroenterology, or ureteral calculus, which would point towards urology? Without coding, the abbreviation does flow over in the right place, but it comes across just as free text, which leaves the family doctor to interpret the meaning before deciding next steps. Coding systems are used to standardize clinical terms so they're interpreted in the same way across every system in every workflow. SNOMED CT for clinical data, ICD for diagnoses, LOINC for lab tests, and NDC or RxNorm for medication. When systems exchange coded data instead of the free text values, both sides know exactly what it is they're talking about. I-25.2 always means chronic ischemic heart disease, regardless of whether the sending facility calls it CAD, coronary disease, or heart blockages. Now, we do have codes for almost everything that would go into an EHR, but coding all of those data elements requires a massive effort. It requires significant time from clinical SMEs to validate mapping accuracy and from IT teams to configure and maintain those mappings over time. Having every single field discrete also creates a burden on end users. Making every single thing something that you have to click into a field just disrupts workflow in a way that's simply untenable. Focus should be on regulatory requirements for billing and quality reporting, and then coding for safety and continuity of care. For example, problem lists, allergies, medications, and results. There are some emerging AI tools and natural language processing that are trying to help attach some of those standard codes to information that is going into the EHRs, and that does have potential to reduce the burden on providers, clinicians, and coders. However, it does still require some oversight to achieve broader semantic interoperability. So next time you're working on an interface, data conversion, or system integration project, remember it's not always about just getting information from point A to point B. If the data is going to be used to drive clinical care, it's also about making sure meaning and context are maintained. If you want to continue the conversation on semantic interoperability, I encourage you to check out the Dragon Network, where we have a few articles and conversations on the go. I'll put a link in the description, and I'll see you again next time.